On ways to make that happen, at least to a certain extent, with a myriad of materials that do not require any downtime and give you that instant gratification. We've heard of fillers like collagen and Restylane used to plump up the lines around our nose and mouth. Well, now there's Juvederm, a gel-based filler that's been used in Europe and Canada for the last several years and has a proven track record. It'll soon be available here in the U.S. Facial plastic surgeon Tim Greco is currently working on a controlled study to compare Juvederm to Restylane, the current #1 filler on the market. Hyaluronic acid is the key ingredient in Juvederm, a normal complex sugar our bodies produce naturally.
And what hyaluronic acid does is it provides volume and hydrates the skin. Actually, it's an interesting molecule because it can actually retain 1,000 times its weight in water. So it pulls water into tissues, and in pulling water into tissues, it hydrates the tissues and lifts them, and that's where
plumps it up.
Plumping, exactly.
Over time, our bodies produce less hyaluronic acid, causing dry, wrinkle-prone skin. Juvederm provides hydration through the hyaluronic acid molecule, and it can be used all over the face.
This product can be used to help plump lips, can help with the marionettes. It's also really nice for the tear trough sulcus, for when you start getting that hollowness underneath the eyes or the dark circles. It's also great for the pre-jowl sulcus. You can actually inject a little bit in there and give the patient a little bit of a mini lift without actually having the downtime.
So what you're saying is you can sort of sculpt the face?
That's a great way of putting it. That's what's so neat about these hyaluronic acid fillers, is they give you the potential not only to improve wrinkles, Janet, but also to resculpture the face and give volume to the face.
All right, so you're going to give a demonstration for us, which should really kind of show us exactly how you inject this particular filler.
Yes.
And we talked about immediate gratification or instant gratification. We should be able to see something.
Absolutely.
With that first injection?
You will see an immediate result.
All right, so you have to stay tuned to the report. Tomorrow night, we'll see how Juvederm is actually administered. It's quick and delivers immediate results. Part 2, tomorrow night right here on Art Fennell Reports. If you have any consumer questions, I want to hear from you. CN8.TV, that's where you can find me. You can also call me, ring me up on the phone. That number, 1-877-862-9374. Last night, we told you about a very new product set to hit the market in January. Juvederm fills in lines around the face and gives a smoother overall appearance. Facial plastic surgeon Dr. Tim Greco is one of a handful of doctors right now involved in a controlled study to see exactly how it measures up to other fillers like the #1 seller right now in the market, Restylane. Tonight, a look at exactly how Juvederm works when it comes to softening facial lines and wrinkles. Our patient is Laurel Fairworth, looking for some softness around her nasolabial folds or laugh lines. A tiny needle is used to make the injection. Do these hurt?
Well, with a little topical anesthetic that we're going to put on here, it's very tolerable. So what we're doing is we're going to clean the skin of any makeup, and then what I'm going to do is just apply a little bit of numbing cream.
Oh, see now? Doesn't that make you feel better?
Much better. I'm encouraged.
How does this differ from Botox, for example?
That's a great question, Janet. Botox relaxes the muscle that creates the wrinkle. And what filler does, like Juvederm, is it fills the wrinkle up. We're going to start, and we're going to just inject the nasolabial fold, or what we refer to as the smile line. And the smile line goes from the corner of the nose down to around the corner of the mouth.
Now she's got a ball she's hanging on to. She's
squeezing.
Like biting a bullet.
Ball. Okay, I'm ready.
This is known as squeeze anesthesia. Turn this way, Laura, for me for a second. And what we're going to do is we're just going to start to inject here. Okay?
Mm-hmm.
Yeah.
The entire procedure takes about 15 minutes, and both sides of Laurel's face are done. This is immediately after the injections. Still a bit red, but you can see the difference in the before and after. Her new look is softer, with less defined lines around her nose and mouth.
Well, it wasn't horrible. You feel it a little bit, but it's not bad.
Not bad, she says. Now, many people are opting for non-invasive procedures like the one we just saw. It is quick, and you do see immediate results, but it's not exactly cheap. One syringe runs between $550 and $700, and it lasts for up to about 9 months. Again, Juvederm will be available to the public in January of next year, and if you would like more information, go to www.drgrecoface.com.
You got an email, and let me get to this. Cheryl is writing in. She wants to talk to Janet, and she says, Janet reported on a new procedure for aging skin. Can you give me more information on this? What is the procedure called, and which doctor has it? That's from Cheryl.
Yeah, Cheryl, I'm going to tell you right now, the product is called Juvederm, and it will be available to the public in January of next year. And if you would like more information, you can go to www.drgrecoface.com. He has been involved in a lot of clinical studies over the last few months to find out the effectiveness, the efficacy of Juvederm, how it compares to other fillers.